Welcome back to Body Beautiful. Right now we're talking with Dr. Mealy about liposuction. We'll be taking your calls with any questions you might have for the doctor. Here's the phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you'll certainly want to consult your own physician as well. Before we get to the phones, what are some of the most commonly treated areas?
The most common areas are the trunk and the thighs, though you can treat the neck, the area underneath the chin, the arms, the back. Doesn't respond quite as well because the back skin is so thick, but usually the belly, the love handles, the thighs.
Do you get a lot of folks who say, there's something right here, just a little fat starts to gather, and
and again, the liposuction works better for folks who are younger because the skin will recoil. As we get older, the skin gets a little loose. Sometimes doing liposuction makes it look worse because you're losing the stuffing and it just falls a little bit farther. But when you're younger, it kind of pops right back up.
Okay, because you have more elastin, collagen.
Yep, recoil.
Okay, you brought some pictures, so it'll give us a better idea of what's really going on.
Yeah, I'm trying to compare lipo to surgery with these.
Okay, apparently we have some arms first, and what's to the left?
So on the left is before and the right is after.
And that's just
liposuction. So this is someone who has good skin tone, sort of done somewhat circumferentially, though the majority of the fat tends to come from the bottom part of the arm, and the skin can shrink up and accommodate.
Wow, okay, that's pretty, and was that, can I ask the age of that person?
Probably in their 20s,
okay,
20s
so
to 30s.
That made a big difference there.
Yeah.
So the skin had its ability to bounce back.
Exactly.
Without any help. All right, let's go ahead and roll to the next picture.
The next patient, too much skin.
Okay.
So if I would try to do liposuction here, she would end up with just the skin hanging off of her arm. So in this case, this is a brachioplasty. So there are some limits to liposuction. It can't shrink the skin as much as we would like. Right.
So
in this case, if the skin's cut,
is that a combination? You've used the liposuction and then also surgery?
Surgery.
Just the surgery?
Just the surgery.
Okay. And we're not looking to see the under, where would the scars be?
The scar that runs right along the bottom, it's just barely visible there. Okay. I try to keep it on the lower part of the arm so that in normal positions we just don't see where it is.
Okay, well that's helpful. And let's go ahead and roll the next picture.
Now this also is liposuction. This is someone who's in good shape. They're at their ideal body weight. They did not like the bulge on the back, so they call it the muffin top, and the little bulge underneath. So when she's wearing tight jeans, the fat would allow the skin to come
muffin
forward.
Top
so then afterwards we're able really to smooth that out in the back and in the front.
Okay, now some people call those love handles. And she was not able to do that at the gym to get rid of
No, she's in really good shape. I mean, she's at her ideal body weight, and losing more weight may make her look emaciated in the face or the arms or other parts of her body.
Right. And so, how much exactly in terms of volume was removed?
In this case, about 1.5 liters.
Okay.
So that's about 3 pounds.
3 pounds? Yep. It just doesn't look like there's even that much there.
Doesn't seem like much, does it? But it's all from those specific areas.
Okay. And there's no surgery involved in that?
Nope.
But now, okay,
now this is someone, again, with extra skin. So with tummy tucks, we usually are taking care of that extra skin as well as tightening up the muscles and getting rid of the fat down below. Again, liposuction here would be disastrous. If I did liposuction, I'd end up still with those folds that are there, except they'd be more irregular in shape.
And so, can I ask what you did exactly?
Sure, this is a tummy tuck. So in the center there where that fold runs across the middle of her belly, her belly button's hidden up in there. So I haven't made a new belly button, it's her same belly button. It's just that all that extra skin has been removed and the skin on the upper abdomen has been pulled down. So clothes fit better.
Yeah, well, very much better. After childbirth, that sometimes the body is just stretched beyond recognition. Is that the case here? And
childbirth can do it, or weight gain and then weight loss. Okay. If someone's just gaining weight and getting bigger and bigger, tummy tuck is not going to help, and neither really does liposuction.
And then what happens to muscle tone?
The muscle gets stretched out too. So the problem is fat can grow in front of the muscle or behind it. So the fat that's behind the muscle will push the muscle out and just stretch it out. And that's more common in men and also more common in pregnancy because most of the mass is behind. For women, a lot of the fat tends to be in front of the muscle underneath the skin. And that's an area that's more amenable to liposuction and tummy tuck.
Now the liposuction, the recovery time is fairly quick, is it?
It is. Compared to the other operative surgeries where we're making a scar and we got to let that heal, the liposuction recovery is much faster. Most people are back to work by 3 or 4 days. They may still feel sore like they did a workout, muscle sort of pain.
A special garment?
I do have them wear a garment. You have more compression garments. Not everyone does, but I think the majority of plastic surgeons do.
Okay, and then compare that to a tummy tuck. That's
tummy tuck
surgery.
That's surgery. I still use a garment, but there may be drains, which there never are with the liposuction, and the recovery is a little bit longer. It's also a little more sore because with tummy tucks I can tighten the muscle. Liposuction I can't. So the good part about not tightening the muscle is it's not as sore afterwards.
Okay. We've got some phone calls coming in, but we need to take a quick break. For more information about Dr. Mealy, call him 925-943-6353 or check him out on the web at drmealy.com or follow his blog at sanfranciscoplasticsurgeryblog.com. When we come back, we'll continue chatting about liposuction and we'll be taking your phone calls.